Good day. Our case for today is rheumatoid arthritis. Here we have ACV, a 26-year-old male who was born on January 4, 1993. He is an English tutor and Roman Catholic that resides in Quezon City. His dental chief complaint was his crowded teeth. For his medical chief complaint, he complained of pain in his joints on his feet, knee, and fingers. For his dental HPI, the patient said 6 months prior to consultation, he went for a routine dental checkup and was diagnosed with class 3 skeletal malocclusion. He was undergoing treatment with orthodontic braces to correct his occlusion. Next is his medical HPI. 5 years prior to consultation, the patient felt sharp stabbing pain on his left ankle. It has a pain scale of 6 out of 10, but subsided gradually within a week. The patient took paracetamol 500 milligrams 3 times a day for pain. 1 year prior to consultation, the patient felt dull, throbbing pain in the joints of his left ring finger, with a pain scale of 2 out of 10. 2 months prior to consultation, the patient felt sharp stabbing pain on his left knee, with a pain scale of 10 out of 10. He went to UERMMC for treatment and was prescribed celecoxib 200 milligrams per capsule, 1 capsule every 12 hours, and he has muscular pain during exertion. For his past dental history, the patient goes to his dentist every month for adjustment of his braces. Next is his medical history. The patient has been hospitalized for dengue fever in 2009. Moving on, we have his personal and social history. His father is a retired electrician and his mother is a housewife. He lives in an apartment in Quezon City. The patient does not smoke and drinks alcohol occasionally.
For family history, the patient's father has hypertension. For his review of systems, everything is normal. We have next the patient's general appraisal. The patient is awake, alert, oriented to person, place, and time. Patient is well responsive and talks in an orderly manner. Able to follow commands without any difficulty. The patient behaves properly and is able to ambulate without any assistance needed. Patient is well dressed for the weather and properly groomed. No signs of distress noted. The patient's posture is good. His vital signs all came out normal. His blood pressure is 130/80 mmHg. His pulse rate is 77 beats per minute. Respiratory rate is 18 cycles per minute. Temperature is 36.5 degrees Celsius. His weight is 75 kilograms, height is 170 centimeters, and his BMI is 26 kilograms per square meter. For the physical examination, the patient has no complaints on his neck, thorax, and lungs. There's also no complaint on his cardiovascular and abdomen. Same with his extremities and musculoskeletal, no complaint. For extraoral examination, the patient's face is symmetrical. There are no temporomandibular joint clicking sounds, no pain or discomfort, no swellings. Lip examination was normal and no palpable lymph nodes. For intraoral examination, the patient's oral hygiene was good. His gingiva was pink and firm, no pathological conditions. His tongue is normal and is in a normal position. He has a class 3 occlusion with a straight facial profile. And this is the patient's chart.
For his dental assessment, the patient has a class 3 malocclusion. For his medical assessment, he has rheumatoid arthritis. Furthermore, we have the treatment plan. The dental diagnostic plan is to have the panoramic x-ray and cephalometric x-ray. The medical diagnostic plan is to have physical examination, synovial fluid aspiration, ultrasound, CT scan, and MRI. Next is the non-pharmacological treatment for dental and medical. For his dental non-pharmacological treatment, he will have he will need to have oral prophylaxis, fitting of orthodontic braces, and recall every month for the adjustment of his braces. For medical, we have reduction of joint loading, which are losing weight and avoiding prolonged standing and kneeling. Another is physical therapy. Patient is advised to have hot showers or bath and get regular exercise. For the pharmacological treatment, in dental, the patient was prescribed mefenamic acid 500 mg per capsule every 6 hours for pain. And for medical, he has it prescribed of celecoxib for 200 mg per capsule every 12 hours for pain. The dental relevance of rheumatoid arthritis is that patient with rheumatic disorders may also be inflicted with Sjögren's syndrome and is manifested orally as xerostomia. These patients have a higher risk of developing dental caries, so their oral health must be closely monitored in conjunction with their chief complaint.